Colleagues, this is Dr. Shanchari Sarkar presenting before you study of complete blood count parameters in patients with pterygium. We have no financial disclosure to make. As we all know, pterygium is a degenerative disorder of conjunctiva which presents as a triangular fleshy fibrovascular proliferation from the bulbar conjunctiva onto the cornea, located mostly on the nasal side. In India, the prevalence ranges around 9.5% to 13% and is most commonly seen in the rural areas of the country. Regarding the pathogenesis, it is mainly associated with UV light exposure. However, it remains quite controversial. Therefore, role of other factors are also being studied. Elevated levels of nitric oxide and reduced levels of superoxide dismutase and catalase have been found in the tissue of primary pterygium, which suggests the involvement of oxidative stress in this pathology. Elevated red cell distribution width levels may be related with increased oxidative stress in the presence of pterygium. In our study, we wanted to explore the role of oxidative stress behind the pathogenesis of pterygium by trying to study the level of various complete blood count parameters signifying level of oxidative stress in patients diagnosed with pterygium. It was a cross-sectional cohort hospital-based single-center study conducted in the ophthalmology OPD of a rural tertiary care hospital for a duration of 1 year with a sample size of 88 patients, where 44 patients with primary pterygium served as a study group and other 44 patients as a control group. We followed a simple protocol where all the patients were first subjected to routine ophthalmologic examination comprising mainly visual acuity and straight lamp examination, followed by evaluation of complete blood count, where we got all these parameters like the red cell distribution width level, RBC count, WBC count, platelet count, neutrophil lymphocyte ratio, platelet lymphocyte ratio, and mean platelet volume. Following that, we went for the data analysis. Here we can see the mean age and sex ratio in both the groups, which appears to be comparable in all the cases, and also we can see the distribution of the patients according to the length of the pterygium, where we can see 16 patients belong to the each grade 1 and 2, and 12 patients belong to group grade 3, where the pterygium had already crossed the pupillary margin. Here we can see the various values of the various blood CBC parameters in both the groups, and also their statistical significance, the difference. And here we can see only one of the parameters, that is a red cell distribution width, which is statistically significantly increased in the study group compared to the control group. While all the other parameters, there the difference do not show any statistical significance. The same data we have shown here graphically. So to sum up, the red cell distribution width levels, that is the RDW values, were significantly higher in the test group compared to the control group, as denoted by the significant p-value here, while the RDW levels did not correlate with the length of the pterygium. And other indices like the RBC count, WBC count, platelet count, neutrophil lymphocyte ratio, platelet lymphocyte ratio, and the mean platelet volume were comparable in both the groups. Although there are many publications showing the influence of UV radiation, the role of the antioxidant system is still subject to discussion. In a previous study, and there has been only one study regarding this by Kotal B. et al., they noted that red cell distribution width level was significantly higher in patients with pterygium compared to controls. In our study also, RDW values were significantly higher in the test group, and RDW values did not correlate with the length of the pterygium, and the other indices, like we have already discussed, were not significant also. So we may conclude that higher RDW levels in pterygium emphasizes the role of increased oxidative stress in disease pathogenesis. Further research in this area may guide us to develop newer treatment strategies in future. Our study has certain limitations, the most important one being not considering the levels of other inflammatory cytokines like CRP. These are my references. Thank you.